Thanks. Look, we support the bill. As I understand it, this is essentially dealing with one of the outworkings of Brexit and trying to recommence what was the case before Brexit, that medical graduates from the UK and the North can do internships down here, and that would be beneficial, obviously, for the health service down here. So we support what the bill is trying to achieve, but as others have said, it does highlight the fact that we have a more general problem in terms of recruiting and retaining healthcare professionals in multiple disciplines right across the health service, to the point that our health service is creaking at the seams. I think it is fair to say, and where we have very, very many people working in the health service who are demoralised, who are burnt out, and leaving the health service to work in the private sector, or to leave the country entirely, or to leave health professions because they simply cannot bear the pressure, the stress that they're facing and the conditions that they're facing across much of the health service. Indeed, I have a family member who's been long-term in hospital over the last few months, and although he would sing the praises of all the staff who've been looking after him, he just tells me every time I go in to see him that the nurses, the healthcare assistants are just absolutely run off their feet. They're burnt out, they are dealing with too many patients, and they just can't cope quite a lot of the time. So we've got a problem. In broad terms, I think, as Deputy Kenny said, we have to listen to the people on the front line as to what they think is necessary in order to resolve the situation. I don't think that we are doing that, and I'm not going to go list all the different groups of healthcare professionals that we should be listening to, but I do want to speak up for just a few that I've been talking to recently. The first I want to speak up for is physiotherapists. And I hope the Minister is aware that physiotherapists are making what seems to me a very, very reasonable request. It might possibly something that could even be dealt with amendments to this legislation, I don't know, but it certainly seems a very easy legislative change that could have a significant impact in terms of addressing some of the waiting lists that we have in our health service. What the Chartered Society of Physiotherapists are saying is that they need to be included in the list of people who are allowed refer for X-ray. Right? I didn't know this until they informed this, but physiotherapists cannot refer people for X-ray, and as a consequence, they have to needlessly chase after other people who are on the legislative list. It's because it's set down in law, of either doctors or certain grades of nurses. There may be some other groups who are allowed refer for X-ray. Now, this is wasting the time of those doctors and those nurses who could be doing other things, when the physiotherapists know that somebody needs to be referred for an X-ray. So this is adding unnecessarily to the stress on other healthcare professionals, and it means longer waiting times for people to get the treatment that they need. So a simple measure they are requesting is that they would be allowed refer for people for X-ray, as is the case, they inform me, in many, many other health jurisdictions, and I think it was something that, in fact, as part of Sláinte Care, was committed to. So that's really elementary stuff, and I would appeal the legislation that is referred to as a statutory instrument, SI 256/218. I think that needs to be changed to simply include those who are allowed to physiotherapists as a group who, along with others, I think dentists as well are allowed to refer and so on. So the physiotherapist should be allowed to do it. Now that seems like a good measure, and they give, and I would recommend that the Minister read their submission on this, because the figures are quite stark. They are saying that the numbers that they could potentially deal with and the impact on waiting lists are very, very substantial. I won't go through all the details, but so this is about joined-up thinking, right, and about having the most efficient use of the skilled people that we have in our health service, and not unnecessarily burdening others who are already overrun with demands on them, particularly doctors and nurses. So I hope you will listen to that, Minister. The second group I'd like to speak up for, and I spoke up many times for them, so it's been well aired, and the government should be aware of this, is the issue of psychologists. Now, as we know, we are in dire need of a lot more psychologists to do assessments for people with disabilities, special needs in particular, children with special needs, and of course then to provide services for children with special needs and so on. And there are a whole range of other areas indeed where there's a shortage of psychologists, we need them, and the sort of paradox and irony of this is there are lots and lots of young people who want to be psychologists, but there are totally unnecessary obstacles being put in the way of people who want to study psychology, who want to work with children with special needs, people with mental disabilities, mental health issues, and so on, where we know we have absolutely dire waiting lists, people not getting their assessments in the time they are legally entitled to get them, not getting the services. We know in our mental health teams and so on, child and adolescent mental health teams, community mental health teams, there is a very urgent need for more psychologists. And yet, if you wish to do a doctorate in psychology, you have big obstacles if you are doing it in the area of education or counselling psychology. So clinical psychologists who are doing their doctorates will get a salary for the placement work they do and get a substantial amount of the very, very high fees that they are asked to pay. Fees of up to €15,000, which is extraordinary, right? Now many, and I've talked to these young people wanting to be psychologists, if they're not getting paid on placement, the education and counselling one, and if they have to shoulder fees of 15,000, as some of them put it to me, well, basically, if you're working class, if you're on low income, if you don't have the money, you can't be a psychologist. You'll just be forced to drop out. It's just too much, right? So why do we have a situation where we fund some, not enough, I would suggest, clinical psychology doctorates, to some degree, giving them a salary and paying most of their fees, but we do not do the same for educational and counselling psychology? It makes no sense. And again, I would refer the Minister to the Psychological Society of Ireland budget submission. It's not the first time you met them, indeed. So to me, it's a slam dunk. It's an absolute slam dunk that we should do this. Indeed, I mean, the number of young people I'm coming across who are really interested in the area of mental health, they want to go into this area and we're putting obstacles in their way. It makes absolutely no sense. They say the figures for extending the salary and the assistance with fees to education and counselling psychology is a derisory 1.7 million. It's nothing. Absolutely nothing. They say that for an additional 50 trainee psychological posts across the professional doctoral programmes for a 5-year period would be an extra 2.45 million. 12 million over 5 years. Now that again is buttons compared to the wider health budget, but would have a very, very serious impact. And they are also saying that to coordinate the management and placement of current and increased numbers of trainees, the government should fund with immediate effect the establishment of a national psychology placement office as the HSE has recommended, which would require the funding of just a measly €770,000 per year. Again, this is buttons, but could have a very real impact. And I would say, by the way, when you think about the sort of mental health issues and so on that we have in our schools, I personally believe we should have psychology departments in every single school in this country. Right? I really do. And it would have it would be a real assistance to our young people who are significantly impacted by all sorts of mental health issues and need support. And there's lots of young people out there who want to do this kind of work, to work with other young people, but we need to make it easy for them, those who want to do this, to get the qualifications they need, to get the placements they need, and then to move into working in our health services. One other group I'll just quickly give a shout out for is the graduate medical entry. I think the people who've had previous degrees who then go on to do graduate medical entry. There's a particular name for it, I'm sure your officials know it. People who've done other degrees and then want to move on to medicine, right? So they haven't done a primary medical degree, they've done another degree, and then they go on to do medicine. There's a pathway for them to move from whatever other degree they did into medicine, but again, they are faced with absolutely shocking fees, right? And this is crazy. When we've such a shortage of doctors, why are we putting obstacles in the way of people who want to study medicine and to go and work in our health service? The other thing I would just say broadly, right, in terms of recruitment and retention, is and this came up in terms of the student nurses, but I think this could apply to a lot of healthcare professional areas, right, where there are real difficulties in people just surviving day to day, studying, whether it's nursing, midwifery, other, the people I've mentioned often just have real day-to-day cost of living, accommodation issues because they're studying. They're not sort of paid properly, and so they can't afford accommodation. They drop out. There's all sorts of pressures on them. I personally believe we should introduce bursary schemes, right, to incentivise people, essentially to fund them in these areas of healthcare where we have a dire shortage of people, whether it's in nursing, midwifery, psychology, or whatever, other areas. And what the quid pro quo could be for such bursary schemes is that if people get a decent bursary, that they would then commit to work for a few years after they qualify in the health service, right? So we assist them in getting through their qualifications, so they're not struggling, they're not paying shocking fees, they get some sort of proper stipend to sustain them and allow them to pay their accommodation costs, and as a quid pro quo that they would commit to give a few years in the health service rather than leave the country, as so many do, because the situation is so difficult for them. So those are just a few practical suggestions. Very finally, though, I would say, and I suspect the government, although we are committed to this under Sláinte Care theoretically, is I personally believe that we have a lot of the capacity we need in the health service in this country, but the problem is a significant section of that capacity is privatised because we have a two-tier system. And that is just crazy. And you hear it it infuriates me when I hear the ads for private emergency departments, private hospitals, and the implication of these ads, you hear them on the radio every day, is, look, if you go to the public ED, you're going to be waiting for a day, half a day, 2 days in a war zone, but come to us if you can afford to pay it and you'll get treated straight away. Right? In other words, the capacity is there, but it's only there if you can pay. Right? So there's huge amounts of additional capacity in the private system, but only available to people who can afford to pay very expensive private health insurance. That, to me, speaks of the obvious need to integrate, to have a single-tier, universal, publicly run system rather than two-tier system we have. We were forced to recognise the need to do that during COVID. Surely we should make that a permanent state of affairs by having a single, integrated, single-tier, universal, public health system.